Ladies and gentlemen, welcome to today's Supportive Care Coalition webinar. Today's presentation is titled Self-Care in Times of COVID, presented by Dr. Michael Kearney and Dr. Raduli Weininger. Before we get started, I'd like to mention that today's session is being recorded and you are currently in a listen-only mode. You will be receiving an email tomorrow with access to the recording to listen to on demand. We will be having a question and answer session at the end of the presentation, and you may type in your questions to our speakers at any time using the questions panel on the right side of your screen. If you experience any technical difficulties during today's webinar, you can click the Help tab at the top of your control panel or ask me a question directly in the questions panel. Now, without further delay, it is my pleasure to introduce your moderator for today, Denise Hess, the Executive Director of the Supportive Care Coalition.
Thank you so much, Brianne, and welcome everyone to today's Supportive Care Coalition webinar. Thank you for taking this time out of your busy schedules to participate and really give yourself this gift, whether you are listening live or later on a recording, whether you're listening by yourself or listening with your fellow team members. We welcome you. For those of you who are learning about the Supportive Care Coalition for the first time, the Coalition is a partnership of Catholic Healthcare Ministries from across the United States, dedicated to advancing excellence in palliative care through ongoing advocacy efforts at the local and national levels, through interprofessional education, through resources in healthcare ethics, and the integration of spirituality in palliative care practice. Coalition members have complimentary access to these monthly webinars, numerous resources on our website, and most of all, a community of like-minded learners from all disciplines represented in palliative care. Our newest resource available on our website is our new webinar series called Navigating New Realities, Best Practices in Palliative Care During COVID-19. This series highlights palliative care clinicians, again from across the U.S., who are navigating the new realities of palliative care and healthcare in the light of the COVID-19 pandemic. More information about this series is available on our website. Today, we are especially blessed and excited to welcome Dr. Michael Kearney and Dr. Raduli Weininger. Dr. Kearney is a physician with over 40 years experience in palliative care. He is the medical director of the palliative care team at Cottage Hospital in Santa Barbara. And his latest book, which I can't recommend highly enough, called The Nest in the Stream, Lessons from Nature on Being with Pain, offers an ecological model of self-care and resilience. Dr. Kearney is joined by Dr. Weininger. She is a clinical psychologist and teacher of Buddhist meditation and Buddhist psychology. She is mentored by Jack Kornfield in her teaching and by Joanna Macy in her interest in engaged Buddhism. And actually, I have to qualify my earlier endorsement of Dr. Kearney's book. Dr. Weininger's book, Heartwork, The Path of Self-Compassion, is also one of my favorites. I return to it often, and you'll understand more why after listening to their presentation. The book also has a wonderful foreword by Jack Kornfield. And so, without further delay, I will turn it over to you, Michael and Raduli. Thank you again for joining us, and welcome.
Thank you so much, Denise, and thank you so much for the invitation, and we're delighted to be here today with all of you. We don't see you right now, but we know you're there, and we look forward to the more interactive part of the session towards the end. But I'd just like to say at the outset, before we begin the PowerPoint presentation, is I would just like to say that we've sort of envisaged this morning's seminar as a mini retreat. You might have seen it advertised as such, and it's challenging to think about how to do a mini retreat in an hour and a half, in 90 minutes. But what we're going to do is present some ideas about self-care, some of which I'm sure will be very familiar to you. Some may be new, or presented slightly differently. And we're going to present some ideas about different models of practicing self-care. And then interspersed with that, we're going to do some guided meditation. Radley will be leading the first guided meditation. I'll lead the second guided meditation. So that's actually going to be an opportunity for us to sort of practice what we're preaching a little bit. And hopefully you find that helpful and come out of this session not just with some new ideas, but also actually having had a little bit of a break. That's what we're hoping for. And then the final part of the seminar, we're really going to put out an invitation to hear from you about some of your self-care strategies, some of the things that you found, especially in these recent months of the COVID pandemic, that have actually helped you not just survive, but hopefully to thrive, through these days, these challenging days. Is there anything else, Radley, that you'd like to say at the outset?
Yeah, hello, this is Radley Weininger, and I'm excited to teach you today. And I'm aware this is a really difficult time I see with my students and clients and myself, that COVID-19 and the whole social tension that's going on right now really has upped the ante for all of us in terms of stress and magnify how we can hold it together professionally. And so I think meditation and self-care is really important right now. I wanted to say that if you get interested in this and you want to continue with meditations, we give a whole series of meditations every week for free, which you can Zoom into, and maybe we can leave that information in the end. So if any of you, there's no commitment, you can just come whenever you like to join us for some meditations. I think between us and other teachers, there are 15 hours, different times a day and hours a week. That would be a wonderful way to continue the practice.
Thank you. Thank you. So let's begin. So these comments about self-care in times of COVID are comments that obviously apply in all times, but I think are particularly pertinent in these very stressful and uncertain times. And I'll just speak a little bit to some of the sort of specific stresses. So the overall objectives of this session I've already touched on. First of all, to understand the three common occupational stress syndromes: burnout, vicarious traumatization, also known as compassion fatigue, and moral distress syndrome. And then to think of self-care in terms of three possible ways of responding: a practical response, a psychological response, and a spiritual response. Say more about all of these when we get to them. And then, as I've already mentioned, to actually experience some of what we're talking about through two different guided meditation sessions. And then we'll have the time for discussion at the end. So the three commonly recognized occupational stress syndromes are burnout, vicarious traumatization, and moral distress. And let me now just say a little bit about each of these. And to begin with, the one I think we all know, and when any of us think of stress, I think burnout is what comes to mind for most of us. And it is the most commonly recognized occupational stress syndrome. And indeed, as I'll comment again later, it is the endpoint of the other syndromes as well. So it's a common endpoint. But when burnout arises as an entity in itself, it results primarily from stresses between us and our work environment. So more bureaucratic type stresses. I mean, that might be long working hours, that might be limited resources, that might be, as the oncologist comments at the bottom of the slide here, what burns me out, the full sentence was, what burns me out isn't losing my patients. What burns me out is fighting with insurance companies. So it's those kind of more administrative, bureaucratic stresses over time, overworked, underpaid, underrecognized, that can kind of cause the sort of slow burn grind that in time leads to burnout. And when Maslach did her work about 20 years ago or so on the prevalence of burnout among healthcare practitioners in North America, she found among physicians and nurses a prevalence of about 30%. Now, what's interesting is that number generally doesn't go below that, whatever specialty area you look at, or whatever occupational subset you look at, but it goes up considerably in some settings. And I remember doing some research on this some years back when we were working on an article around all of this, and I kind of thought, working in palliative care and finding it stressful, and actually I realized at the time of writing the article, when I saw the symptoms of burnout, I realized I was pretty burnt out myself at that time. But what my presumption was that palliative care might be a more stressful specialty area of care than, say, internal medicine or oncology, for example. Well, it turns out oncology generally compared to palliative care has a higher prevalence of burnout, and some areas of oncology, like pediatric oncology, can have a prevalence of almost 50%. And we also see a high prevalence of burnout now in medical students and in residents. So this isn't just for experienced clinicians, and it's also affecting folks from the very beginning of their career in healthcare. And the common symptoms of burnout, and when I was going through this, it was kind of a question, it was a matter of check. Feelings of overwhelming physical and emotional exhaustion, a type of tiredness that you feel sort of in your bones, and that just doesn't leave even after a good weekend break or even after a vacation. It's just hard to shake it. This can be combined with feelings of detachment or dissociation, so just not as engaged in the process of caring in the way you were previously. And that can lead to a sense of detachment and cynicism. And the third kind of feature, kind of characteristic feature of burnout is a sense of never quite achieving the sort of quality in your work that you would like to see. So you always feel like you're coming in a little short, or your team is coming in a little short. Sorry, I'll just go back one there. And that is, that's called lack of personal accomplishment, that sense of lack of personal accomplishment. So that's burnout. Then the second of the occupational stress syndromes that we recognize is, as called here, vicarious traumatization, also referred to as compassion fatigue, or secondary traumatic stress disorder. And as the name suggests, this is where we are vicariously or secondarily traumatized by being empathically close to somebody who is primarily traumatized. So by being close to somebody who is suffering greatly, who is experiencing or has experienced severe trauma, severe loss, and is suffering greatly because of that, it's possible for us to experience that as a secondary trauma. And when that happens over time, and I think sometimes, what I've recognized for myself working in palliative care for a long time is that I think this happens on a day-to-day basis. It just kind of goes in below the radar. It's not just about the big traumatic situations that we're at the bedside of somebody who's going through some kind of major crisis and it's traumatizing. It's not just that. It's the kind of day-to-day being in the presence of folks who are really going through a hard time, who are really suffering. And I know those of you who've been on the front lines of caring for patients with COVID-19 will have been in situations that are potentially very traumatizing. And so I think vicarious traumatization is something that we in palliative care are particularly vulnerable to. And it's unlike burnout, which evolves, as I said, between you as an individual and the administration or bureaucracy. Vicarious traumatization evolves from your relationship with your patients or with the families that you're caring for. So it's more within that human interaction. And of course, this is not to suggest that empathic engagement and caring is something we shouldn't do. Of course, we should do it, and it's at the very core of what we do in palliative care. But it's kind of alerting us to the fact that this, over time, takes a toll, and there are ways of mitigating that toll, and we'll talk about those later. One of the kind of really valuable ways of mitigating that toll is actually through the cultivation of mindfulness or self-awareness and self-care. So the symptoms and signs of vicarious traumatization are really those of you that are familiar with the symptoms of PTSD will recognize the same symptoms here, because this is secondary PTSD. You as a caregiver experiencing PTSD because of the kind of secondary trauma you've experienced. So that may be through, increased arousal experienced as hypervigilance, for example, or difficulty in concentrating. It may be through re-experiencing flashbacks, if it is a kind of a major traumatic event that you've been witness to or part of. It may affect one's sleep with nightmares. Or you may notice a sort of social withdrawal or avoidance, a kind of situations that you anticipate may be similar to the event that was traumatizing. You see if another team member could perhaps take that patient. Sorry, the slides have a mind of their own. They're moving forward just a little ahead of time. So we just kind of notice these symptoms. Now, these symptoms are the acute symptoms of vicarious traumatization. So I notice a lot of these in myself on Friday evenings at the end of a hard week and at the end of maybe a tough Friday. And those of you who work in hospitals, as I do with the palliative care team, will know that kind of while other teams, well, at least in our hospital, tends to wind down a little bit, especially on Friday afternoons, we get a lot of referrals on Friday afternoons. People kind of signing their patients out at the end of the week before the weekend. So we often end up having very busy Fridays, and I often come home at the end of a long week, sort of pretty fried, and with some of these symptoms. So these are more the acute symptoms of vicarious traumatization. Chronic symptoms of vicarious traumatization really morph into the symptoms of burnout, and indeed eventually, I think, leads to burnout. So the third occupational stress syndrome, and this is one that was first described within the nursing literature probably about 20 years ago. Moral distress syndrome, I think probably a very common occupational stress syndrome. I think one that's been around for a long time, but maybe just not named explicitly. I think it's been very helpful having a name for it. And I think probably one that is very prevalent in these COVID times. And I'd be interested to hear from those of you who are working or have been working in more acute situations. We've been lucky here in Santa Barbara in that we've been preparing for a surge of patients, but we really haven't had a big surge. We've had a steady kind of stream, but it's been sort of manageable. But those of you that have been working on the East Coast and perhaps in the New York area, for example, may well have been working in situations where you have to make some really horrendously difficult decisions about limited resources or prioritizing resources for patients with moral distress. You want to say something?
Yeah, I was thinking that moral distress is also about, we see a lot of Black and brown patients being especially affected. and old people in nursing homes and people in prisons and at the border in camps. And that is also moral distress syndrome, that one feels powerless about how maybe social, economic realities, racial realities impinge, and we can't do much about it, but we feel it.
Yeah.
And our hands are a little tight, or very much tight. And so that's also part of moral distress syndrome right now.
Yeah, thank you, Adelaide. That's kind of broadening it out into the kind of more social context, which is very relevant. And really picking up on the definition of moral distress, which is the kind of distress that's generated when you as an individual have identified what you feel is the ethically appropriate action, what's needed. You know, somebody needs to be treated, somebody needs to perhaps should go on a ventilator, in your opinion, but you're prevented from acting in accordance with your convictions by external constraints, maybe limited resources, and often expected to act against your convictions. So that, as you can imagine, as you know, generates enormous distress. Or the situation, you know, this is obviously in pre-COVID days, because nobody's wearing a face mask, but or PPE. But you know, a patient who has perhaps had multiple attempts at resuscitation in the past, and has perhaps indicated that they are now ready to let nature take its course should it happen again, but perhaps they lost decision-making capacity, and a family member said, no, we would like you to try one more time. Whereas you as a caregiver who've been looking after this person just feel very strongly that it's their wish, it's their time, but you are kind of compelled by external restraints to go against that sense of what you feel is the right thing in the moment. And so moral distress over time can, as you can appreciate, lead to feelings of frustration, powerlessness, feeling devalued in your opinion and marginalized. And over time, this can leave a sort of lingering sense of what's being described as moral residue, a sort of sense of being personally compromised by these decisions that have been forced on you, really, rather than ones you've made yourself. Over time, this too can lead to burnout, and one of the kind of features we see of burnout over time is clinicians leaving their profession. So just to kind of add a few more sort of specific stressors that we might, you know, have been experiencing in these times, and I'm sure there are many others that we could add to this list, and I'd be interested to hear from you later in the session about those. You know, but just kind of acknowledging that, you know, what we do in palliative care carries its own stresses, but that there really are some unique stresses associated with caring for our patients and their families in these times. Some of those unique stresses relate, as we said earlier, to kind of overwhelming workload and limited resources, or a fear of such. But some of us may actually have had to work in situations where we've had to do our best in those kind of situations, but just the kind of difficult decisions that ethically difficult decisions that's forced us to make. And all in an atmosphere of a lot of uncertainty, so much uncertainty and fear because of the nature of the illness, the fear of contracting the illness oneself or one's colleagues, but also the fear of bringing perhaps infection home to one's family. So kind of there's just acknowledging that fear is around with COVID in a way that kind of isn't perhaps there in the same way with, you know, our day-to-day palliative care situations. And yeah, having to make these really difficult decisions. And thankfully, I mean, we in Cottage Hospital where I work have had to anticipate making these decisions. And I've had colleagues who said these discussions have been some of the hardest in their kind of 30, 40-year clinical practice. You know, they found that really, really stressful to have to think this one through. But some of you have actually been on the front line of this and having to make these decisions. And then not only that, but having to go and communicate that to families, and families who can't be at the bedside, families where you can't sit down and have a family conference in the, but where you have to do this communication, by phone or by FaceTime or whatever. So and so kind of emotional responses we see in our patients and families every day, fear, anxiety, grief, but also perhaps in situations of limited resources, kind of seeing kind of more anger, and also seeing anger coming through family members who are kind of limited from visiting and being with their loved ones who may be sick or even dying with COVID. So I think all of these kind of just turn up the heat on the three occupational stress syndromes we've already discussed. And just kind of the last bullet was really just one when I was giving this presentation just recently to medical residents in our hospital, just telling folks to remember that's part of what we're there for. We see our role in palliative care as being also to kind of be there for folks to curbside, to actually provide support to our colleagues in kind of informal ways, and spiritual care very much make themselves available within our hospital for the same reason, as do other programs such as employee assistance programs. And then there are other hospital-based, but also other community-based resources that we can put folks in touch with. So the common endpoint of all these occupational stress syndromes is burnout. Organizational kind of stresses, value mismatch, and then just the kind of secondary trauma with interacting with grief and suffering. Common endpoint, burnout. So how do we respond? What ways have we of actually mitigating some of these stresses, actually reducing some of these stresses, so that stress is inevitable, and up to a certain point, as you know, there's that kind of graph where up to a certain point, stress actually increases efficiency, but when it goes above a certain level, it actually has the opposite effect. How can we mitigate these stresses so that they don't reach that tipping point where we enter one of these occupational stress syndromes? Because burnout particularly is a very difficult one to come out of. It's not impossible, but it's really difficult. So it's best if we can catch it upstream. So let's think about some of the strategies that we can use to do that. The first one is what we might call a practical approach to self-care. And when most of us think of self-care, this is probably what we do, even if we haven't thought of it as self-care. And that is that partly we have some protection in our work environment through our boundaries, through our professional boundaries. So, we may or may not wear a white coat. We may or may not wear a stethoscope around our neck. We may or may not have some kind of uniform we wear in our workplace. But we all of us have our professional personas. We all of us have our professional role. And that gives us an invisible protection of some kind. That is in itself a protective boundary, a bit of a suit of armor, as you see on the right. If we totally rely on practical, on kind of a boundaried approach to self-care, there's a danger of it becoming a kind of a rigid suit of armor, like you see on the right here. And while that might be extremely protective to us, so-called clinical objectivity, and not getting that involved in situations that could be potentially stressful emotionally, while that can give us a lot of protection, that can also leave our patients and families feeling pretty unhappy because they feel that they have somebody involved in their care who doesn't really care, who they don't really connect with emotionally and at that kind of human level. So while professional boundaries are important, And there's another aspect to boundaries as well, which kind of ties into the second aspect of practical self-care. And that is actually, being disciplined about taking your time off, actually leaving work on time. When you get home from work, a lot of us, including me, one of my strategies when I get home from work is I change out of my work clothes. And of course, in COVID times, a lot of us are going to work in scrubs and coming back. And of course, we take those off, change them every day. But even otherwise, just coming home, having some kind of little ritual that leaves work behind and that kind of enters the rest of your life. And then having activities that are restorative, that engage you in an activity or with people or spending time with people who matter to you, or in activities that replenish you, give you rest, relaxation, but also actual replenishment. And so just that boundary line too is important. The boundary line of knowing when to leave work and being good about taking your vacation and taking vacations that are really going to be restorative. So that's practical self-care, and that's kind of common sense self-care, what we all do all the time. Now, this overlaps with the second model of self-care. All these three overlap. They're not so much separate little stones as you see here, as overlapping circles. And psychological model of self-care is something that I'll speak a little bit about, and then I'm going to hand over to Radley to say a little more about. But this was an article that Radley and I and three other colleagues, including we were lucky enough to have my friend and colleague Balfour Mount, who is the kind of person who coined the term palliative care at the very beginning and started the first palliative care team on the North American continent in the Royal Victoria Hospital in Montreal. And in any case, Balfour Mount, Radley, I, also Richard Harrison, who's a clinical psychologist, and Mary Vachon, who's a nurse, an academic nurse teacher from Toronto, who's really written a lot and taught a lot about occupational stress and staff stress. So we had a great team working on this article, which was the final article in the JAMA series on what was it called? Perspectives at the End of Life, and it was on self-care. And so what we did basically in the article is we acknowledged the value of the practical approach that I've just discussed, but we said that can really be complemented and supplemented if we add a psychological dimension to it. And so we talked about what we describe as self-awareness-based self-care. And any of you who are interested in this article afterwards, I'd be happy to make it available to you. I may already have sent it to you, Denise, but if not, I'd be happy to do that so we could get it to anybody who's interested. But in our article, we talk about the kind of, in a way, three dimensions to cultivating self-awareness-based self-care, and that is mindfulness, self-knowledge, so that is kind of just getting to know yourself, mindfulness, and self-compassion. And I'm going to hand over to Radley now to say a little bit about mindfulness and self-compassion, what they are, how they can be helpful in the context of self-care, and then that'll lead into a guided mindfulness self-compassion meditation.
So let me talk a little bit about mindfulness, which I personally have been studying and working with now for 40 years this year. Started when I was a medical student in Germany, and then came here and also, besides my medical degree, got my psychological degree. And it just in the years I have been studying, it has become a secular practice, which basically can be practiced with each other spiritual approach together, and which really helps us to find a sense of ground and calm and awareness about itself. It's very much an awareness practice. Jon Kabat-Zinn, who really was responsible for bringing mindfulness from its ancient Buddhist roots into the clinical world, and basically secularize it, calls it moment-to-moment, non-judgmental awareness. And there are different aspects to it that are important. The first one is to be quiet, find a quiet space where one turns one's gaze inward and just becomes aware of what one feels inside. And what's really important there is what I call the felt sense, the physical sensation that we experience in our body, because that allows us to come into the present moment and to just be really aware. It's an awareness practice on how we are inside physically, and how we are physically inside often informs us how we are emotionally inside, and mentally inside, and spiritually inside, and soulfully inside. And that is just a really important turn inward, and to feel the felt sense of our body. And then within this felt sense of our bodies, usually the primary object of our attention, and attention is a very important aspect, is breath awareness. So we are learning to really attend to each instant of breath as it is changing. And what is important about that, breath is something very, you might say, subtle and ephemeral. And as we attend to our breath, besides our body awareness, we learn to attend in a really fine way, which in itself initiates what has been called the relaxation response. You know, it relaxes us to really focus on body and breath. It activates the vagal tone, but it also raises our awareness about ourselves. And from that platform of creating a kind of, you might say, a sense of security within ourselves, we can notice our thoughts and feelings. And also what we notice is our thoughts and feelings going by as process. So it's less about content. What did I think about my mother or my husband or my work situation? It's more, there is a thought and it comes and it goes. Or there is a feeling and it comes and it goes. Or maybe there's a knot in the stomach and that passes by. And so that's one of the important features, that we are present with change and noticing that everything is interconnected and everything is change, which is a really important way of being in life. You know, we are not the cemented in, isolated little balls. We are actually connected with this big web of life, and everything is changing, and we can be present with that. And as we learn on a very physiological way to be present with that, we can be in a much easier way with life. There will be more of an evenness and lightness, and a heightened sense of awareness at the same time. And as it says here in the third point, it gives us the capacity for self-monitoring, or maybe I would say it in a little bit warmed up way, to be with ourselves in a kind and conscious way, even in stressful situations, where we don't contract, where we don't, react to stress with even more stress of trying to hold it in, where we kind of learn to relax into stress and allow it to see it passing by, and be present with it. And the paradox thing is, as we are not trying to just push it under and control it, it actually goes by in a much easier way. So that's in a nutshell what mindfulness is about. And yes, oh yeah. So let me also talk about self-compassion, which is very much connected to compassion, not just for ourselves, but for our world. But to feel really compassionate with ourselves, or kind towards ourselves, allows us to be more compassionate with others. There has been a study with medical doctors, actually, those who are very harsh with themselves are usually quite harsh with others, and those who are able to be more lenient and kind with themselves are also able to extend that kind of kindness and caring out to others. And so it's not self-indulgence or whitewashing or pushing under the rug. It's actually, we can be even more present with ourselves when we have this basis of kindness. Because we are very harsh with ourselves, we are much more likely to be in denial or not, push things out of our sphere of awareness. But we know, if we know we will be kind with ourselves, it's even much easier to be with what is uncomfortable with ourselves. And so it gives us the willingness, here it says, to suffer with ourselves, so just to be with ourselves in an honest and authentic and kind way. And it gives us this readiness to experience our sensations and emotions of hurt without judgment and with more kind and maybe with a more of a sense of warmth, which again, a big part of our burnout is our self-blame or self-criticism. And so it takes that layer of what contributes to burnout or more the stress of compassion fatigue away. And so, and there is a spiral of compassion. If we are able to be kind with ourselves, we are able to be kind with others and our world. We'll be more able to be open-hearted and open-minded. So let me introduce you to a little meditation that that has both aspects of mindfulness and self-compassion. So make yourself comfortable. It's usually worthwhile to have your back fairly straight but your chest open and receptive, and your body relaxed. And you can close your eyes, but you don't have to. You can also have a soft gaze. Let yourself settle into the sensations in your body. Turn your gaze inward and just see what's happening inside of yourself. You might notice the touch between your body and the chair, the ground. Just allow your face to relax, your jaw to drop. Your shoulders to let go. Breath to breathe through your chest, your heart ever so gently. your belly. And feel the felt sense of your body as a whole. Physical sense of your whole entire body and posture. Experiencing your whole body as alive, aware. Just recognizing with kindness whatever you are experiencing. From this field of body awareness, notice breath arising with the in-breath, letting go with the out-breath, falling back into body sensation as a whole. And follow the sensations and movement of your natural breath. Feel your breath. Be your breath. Be aware with every moment of inhale and exhale. Body very gently present with yourself. Allowing your body to be breathed, or breath to breathe you. And whenever you get distracted, your mind starts wandering, your feelings or thoughts, just allow them to pass by like leaves in a river going downstream. Allow them to pass by all by themselves, always returning to your touchstone refuge, the sensation and movement of your body and your natural breath, arising with the in-breath, letting go with the out-breath, body, breath, breathing you. As you experience yourself, allow yourself to hold a sense of kindness, caring. You might feel as you look inward the effects of stress, personally, professionally, culturally. You might feel it in your body, in your face, your heart, your body tone. Be aware of that with self-compassion, with a sense of caring and warmth for your own self. knowing that you do the best you can. You might experience breath itself as an act of self-caring, kindness. Sometimes you might want to say the phrase of self-caring, compassion towards yourself. You might say silently to yourself, may I live my life with ease. May I be safe and free from inner and outer danger. May I be healthy in body, mind, heart, and soul. May I hold myself in kindness when I feel vulnerable or stressed. May I be patient with myself, especially in stressful times. May I live my life with ease. Notice breath brushing through ever so gently. You might extend your well-wishing outwards to those who are close to you, easy to like or love. May you be healthy. May you be safe. May you live your life with ease. Notice breath. And you might extend your well-wishing outward to your patients or clients or co-workers or people you meet every day. May we all be well. May we all live in peace. You might extend it out to the world, our poor, stressed world. May we all be safe. May we all be healthy. May we all live in peace. Come back to breath, the sensation and movement of your natural breath. Connecting inhale with exhale and exhale with inhale. Inside and outside, amongst and between us. Connecting us all. And may the benefits of our practice go out into the world. Feel your gentle breath.
Thank you, Radhali. So let's just talk just a little more about the third model of self-care. Again, remembering these are overlapping circles. There's no hierarchy intended. It's different circumstances may be called for different primary approaches to self-care. Although having this psychological dimension is good in whatever setting we are, having that capacity to self-monitor and to practice self-compassion, as Radhali's just been teaching us. So I want to discuss this third approach to self-care, kind of what we might call a spiritual approach to self-care. I want to introduce you, if you don't already know this article. It's another article. This is an article, I think it's one of the most valuable articles I've seen published in the palliative care literature, in my opinion, in recent years. And again, it comes from Balfour Mount and his group in Montreal. And it's called Healing Connections on Moving from Suffering to a Sense of Well-Being. And Denise, I will send you a PDF of this also. So if anybody's interested, you'll have this as well as the JAMA article to distribute. But this is a qualitative research study where they looked at 20 individuals who were approaching end of life. So these were individuals who had been on palliative care, were now moving towards hospice and end of life care. And they were all perfectly matched in terms of their demographics. So age, social, disease, symptoms, all of that was kind of similar across the board. What was different is that 10 of the group were identified as suffering greatly. Another 10 in the group were identified as thriving, as doing really well. So identical circumstances, but 10 individuals doing really poorly, 10 individuals doing really well in terms of their emotional, psychological, and spiritual well-being. So I hope you're still hearing me. Yeah, there was an alarm that came there. Let's hope it's not significant. So what made the difference? What made the difference as to whether an individual ended up in one group or another? What made the difference was whether or not that individual had in their lives what the researchers called healing connections. And that was a sense of connection or bonding with oneself, with others, with the phenomenal world, or with what was called ultimate meaning, however this is understood by the individual. So with oneself, it's the sort of thing Radley was just teaching us, self-understanding, self-empathy, self-compassion. With others, with friends, family, one's team, one's community, a sense of connection. With the phenomenal world, perhaps through nature, perhaps through music, or art, or certain physical activities such as yoga or exercise. And then connection with ultimate reality, and that's very individual. What that will mean for individuals, it may be through more formal religious practice, prayer, religious rituals. It may be through more, if you like, secular, humanistic spiritual approaches such as meditation. So if an individual had a sense of sort of a living self-sense, as Radley was saying, connection in one of these four areas, it seemed to be transformative. It seemed to give their life a sense of meaning, and it seemed to make all the difference between whether they experienced their quality of life as good or not good, was the presence or absence of healing connections. And the researchers thinking about this, and it's a very interesting article. If you read the discussion part of the article, it's very philosophical, and it's talking about, well, why would that make the difference? And they speculate that what made the difference was if one was connected in one of those four areas, it immediately situated you as an individual in a context that is greater and more enduring than the individual particular self, thus leading to an enhanced sense of meaning and improved quality of life. And so one definition, when we think of the difference between pain and suffering, pain is inevitable. I think it was Jack Kornfield said this, but suffering is optional. Pain is the kind of primary thing that we can't avoid. We have a toothache or something more serious, and we have the pain, but the suffering is what's layered onto that by our emotional reaction to it, by the social implications of it. So pain can lead to suffering. But one component that inevitably kind of transforms pain into suffering is if pain is experienced in isolation. If you combine pain plus disconnection, it leads to suffering. And that is the image you see here, a clear glass of water, but a spoonful of salt. If you put that salt into the glass of water and you stir it and you drink it, it's going to be very salty. Whereas if you take that same spoon of salt and you walk to the end of this jetty and you drop that spoon of salt into this great lake, no matter where you taste the water in that lake afterwards, you're not going to taste the salt. And that's the difference between suffering and healing. Healing being where our inevitable pain, that's part of living, part of being human, is situated in that context that's greater than oneself, in a living context that's greater than oneself. And that's what's transformative, and that's what makes all the difference between a kind of a poor quality of life and a good quality of life. And so I just want to lead you in one final meditation before we enter our kind of discussion period. And this is, for me, an area of really powerful healing connection. And Denise mentioned, thank you, Denise, for mentioning my book, The Nest in the Stream, Lessons from Nature on Being with Pain. And that is because, for me, nature connection is a very powerful kind of portal into that bigger field of connection. And it just reliably works for me again and again and again. And that little book, by the way, is just it's my story of really realizing I was burnt out and how I came through burnout through nature connection. And so what do we mean by nature connection? Well, we're all nature connected. We wouldn't be alive if we weren't. We wouldn't be all sitting here if we weren't inextricably connected with the rest of nature. You know, literally, the reciprocal exchange between our bodies and the green things around us, trees, plants, that's why we're alive, because we're able to breathe oxygen and breathe out carbon dioxide, which is taken in by the trees. And then they breathe out oxygen, which we breathe in. And there's that reciprocal exchange between our bodies and trees and grasses and algae and all things green that make oxygen. And that's kind of a physical example of our inextricable connectedness with the rest of nature. We live with this delusion of separateness. We live kind of something in us kind of tricks us into thinking that we're autonomous, but we're not. We're inextricably linked. Now, what's nature connection? So we're all nature connected by default. The difference is bringing mindfulness to that process, because our connection with nature is usually unconscious. But if we bring mindfulness to our sensory connectedness with nature, some sort of transformative alchemy happens. That can be very powerful and very healing in my experience. And I'm sure in the experience of many of you who just know how different you feel if you are able to take a walk home through a park, are able to spend a couple of hours in a forest. What a difference that can make, even if you've had the most horrendous series of days at work. So what I'd like to do is lead you in a short final meditation that is really a guided visualization in nature connection. And so nature connection, just in finishing, can either be an internal process. For example, mindfulness of breathing, which Radley led us through, that is bringing our mindfulness to a very natural process, which is the breath. That's an example of inner nature connection. Outer nature connection is more connection with the outer natural world. Yeah?
Well, and I would say mindfulness meditation can be a completely spiritual practice. If you see awareness not as something that is moment by moment there, but that is something that's a priori there. You might call it the sacred or the numinous or God, and you know, and if we experience being part of that field and breath and everything arising out of this field and going back into it, then it can be a very spiritual practice if that's what you're open to.
Okay, thank you, Adeline. Okay, so once again, I just invite you to maybe close your eyes And allow your awareness to drop down into your body and all the way down to the ground, all the way down to the sensations of contact between your feet and the ground, between your seat and the chair. And for just a moment, allow your awareness to drop into those sensations of firmness and solidity. And when you're ready, I invite you to allow your awareness to rise up and fill the whole space of your body, from the soles of your feet to the crown of your head, mindfully aware. And as you're mindfully aware within your body, I invite you to notice where in your body you're most aware of the sensations of breath. Sensations, the inhale, sensations of movement of the exhale. And allow your awareness to alight on the sensations of breath like a feather on a wave. Breath rising with the inhale, breath falling with the exhale. And as your body continues to breathe, I invite you, in your mind's eye, in your imagination, I invite you to imagine that you're standing in a forest. You open your eyes in the forest, and there in front of you, not far off, is a tree. And it's close enough that you can reach out your left hand, if you want to, and place it on the trunk of the tree. And I invite you to do that. And as you do that, I invite you to look at the tree, to look at its trunk, to look up into its branches, to look up into the canopy. Notice the detail, the movement, the light. For a moment, I invite you to bring all your attention to the sensations of contact between the palm of your hand and the trunk of the tree. To notice whatever you notice. Smoothness, the roughness, the dryness, the moisture, texture. Just notice what you notice. And for just a few moments, allow yourself to feel what you're feeling. When you have a sense of this, I invite you in your mind's eye to once again open your eyes in the forest with the tree and looking up to see not far off on a branch a single leaf that catches your attention. To bring all your attention, all your focused attention to that leaf, noticing its color, its shape, its texture, whether it's catching the light, whether it's moving in the wind. Just notice that leaf. When you have a sense of that leaf, I invite you once again to close your eyes and to bring all your attention back into your body and back to the breath, back to the sensations of the inhale, the sensations of the exhale. And I invite you to know that your inhale is leaf exhale. That your exhale is leaf inhale. And I invite you to allow your awareness to rest on the sensations of flow, the inhale and the exhale. And I invite you to allow your awareness to become one with that reciprocal flow, receiving all with the inhale, releasing all with the exhale. For just a few moments, to allow yourself to be carried in this reciprocal exchange between your body and the body of leaf, the body of tree, the body of forest. Breathing in the greenness, the life, releasing all that needs to be released. Receiving all with the inhale, releasing all with the exhale. For just a few more moments, allowing yourself to be carried on the effortless flow of the body's breathing. So thank you. Radley will be back in a moment. She just had a fit of coughing, so she had to leave, but she'll be back shortly. Here she is. So thank you. And let me just come to the final slide here. Just making the point that we need to think about this. I would suggest, I'm sure we all have, because no one else is really going to do it for us. I think management, as we, I think are aware, management do recognize that staff support is actually valuable for staff retention, but also for the quality of care, because that's the quality that our patients and families receive and that they tell us about in their feedback scores. So we may get that external support, but ultimately it's up to us to actually think about the kind of stresses we're particularly subject to and the kind of self-care strategies that could be helpful. And so now in our last 15 minutes or so, we'd like to put out this question and really love to hear from you about a self-care initiative that's been effective for you in these recent weeks. So a self-care initiative that was effective for me in recent weeks was. So if you'd like to just take that open sentence and finish it and just kind of type that into the chat box, Denise will collate your responses and kind of feed them back. But it's also an opportunity for any of you who have any thoughts, comments, questions about any of the content or practices that we've shared with you, or indeed any other insights about self-care that you would like to share from your own experience that might be helpful to everyone else to hear. So that's the invitation. And so, Denise, I invite you to kind of join us. There you are. Good.
Mm-hmm. Hi. Mm-hmm. Yeah, thank you both so much. Thank you especially for sharing your practice with us. It's one thing to hear about these concepts and think about them in our minds, but it's a whole different experience to drop down into our bodies and our hearts and our souls and experience them. So thank you for sharing your practice with us. There are lots of comments coming in right now. As those, I would just invite people to continue to enter in your answers to the prompt here on the screen in the questions panel. I wanted to start, though, with one of the questions that came up while you both were speaking, and that was a question about these intersection points between the occupational hazards that you were talking about, Michael, and grief. And then for Radley, the intersection points between a self-compassion practice and grief. a lot of our caregivers, a lot of the audience participants today are experiencing all new kinds of layers of professional caregiver grief. So if you could both speak to that, and then I'll keep working on these many good practices coming in.
Let's start.
Well, that's very interesting you're asking this, because for the last year we have been asked by Inside LA, a big meditation center in Santa Monica, to give grief workshops. So that's something we do once a month to Inside LA. But it is such a time of grief, of just sadness and just feeling the loss, the uncertainty, the sadness about those things we cannot change, about losing something or somebody, or the situation in our profession or in the world the way it is. There's just an immense amount of grief. And to speak with both of our mentors, Joanna Macy, if we can allow ourselves to feel the grief in the world, we can allow ourselves to feel our love for the world. So I find that really important. So it's really important to feel that grief. But the thing is, how can it be safe to feel that grief so we don't get overwhelmed? And so what we have been teaching in our workshops, I think it was the last 1 or 2 years at Inside LA, is to give these, make really safe containers is important. Really as an emotional, spiritual security to have that there, so that people can actually feel the depth of their sadness and their loss and their fear. And then those practices like mindful nature connection, mindfulness, especially if it becomes a bit more of a spiritual practice, which it can be for you, where you feel with the breath and the body and resting in awareness. This is actually a real connecting to the greater web of life. And in that way, there can be this, what I call a psycho-spiritual container for our grief, for the depths of our honest, authentic feelings. And I think a part of that is also, the human connection, like in these seminars that we give, it's really important that we keep it safe, and that we create a sense of safety amongst the people. So safety and security is really an important key besides those practices to allow the fullness of our grief to come up, and with that then to experience also our love.
Thanks, Radleigh. And just what I would just add to that, I agree with all of that, is that what I've seen in those groups is we've been kind of blown away in some ways by so much very raw grief that people kind of come into the room. And for a lot of people, they've never spoken it out loud before. So for, one of the things we do at the start of that session is we say, I am so-and-so, and what brought me here today is, just as a way of people introducing themselves. And honestly, I think that looking back on it, that's probably one of the most powerful healing things of those seminars have been that people have just been able to share their grief and have it heard by others who understand their grief. I think that being in a group of others who know what you're talking about when you've lost a loved one and, you're experiencing that raw grief, I think that's incredibly healing.
And, having that in a way couched in with meditation and maybe with a journal practice, like we ask this question, what brought you here, after we do our initial meditation and a little bit of introduction. So in that way, there is a container, a psycho-spiritual container before the sharing. And I think then the sharing comes from a deeper place.
And that sense of safety is key.
And this grief can be metabolized and integrated.
I'm thinking about the image you just used, Michael, of the teaspoon of salt in the cup versus the teaspoon of salt in the lake. And that's what you're describing is happening in these groups, is there's a diffusion and a sharing through the connections, that safe connections that you build there. That's beautiful. Thank you so much. So we have a marvelous flood of answers and ideas that I hope others will listen to and maybe have not thought of these specific practices. But I'll read a few and then pause and I can keep on going. A daily yoga practice, leaving on time from work, disconnecting from electronics when I'm not at work. As you just mentioned, Radley, journaling, taking a drive, centering on blessings of family, and actually taking a break, getting away from end-of-life situations. I'll pause after this one. Not watching the news.
Right. I just like to respond to one. I mean, all of those are great. Thank you. They're fabulous. And one that I think it's really helpful just to think about is just the value of kind of, if somebody mentioned blessings and being aware of their blessings and counting our blessings, but that, that sense of gratitude and having a gratitude practice, it's not just like self-compassion isn't self-indulgence. Gratitude practice isn't whitewashing a difficult situation. It's actually noticing that even in a really dark tapestry where everything is looking very bleak and very black, there may still be one thread of gold running through all of that. And gratitude practice is about noticing that, the kind of something in one's day, something in one's life that actually is making one feel happy, that is making one feel joyful, that is making one feel well, and actually paying attention to that. That's gratitude practice, and that can be transformed.
And I think I might add that it's important, like the quality, how we are with our patients or clients. When I see myself between 30 and 33 clients a week, some now on Zoom, some in person. And when I do my morning practice of meditation, then I'm just able to be differently present, and I actually have more fun, and there's more of a sense of aliveness. And then my service comes not from obligation or from just duty. It comes from a sense of real aliveness. And I notice in those times when I can do that, I'm not burned out. I'm actually enriched by service. So maybe to keep a little journal for yourself, in what times, in what interactions can you actually feel enriched by your service rather than burned out? Because service can be a powerful medicine, because it gives us confidence, it makes us feel connected, it allows us to be part of the web of life.
And if I could just add to that if we could rethink self-care, again, not as a self-indulgent practice or solipsistic, or, there are we've too many urgent crises to deal with. It's hard to prioritize, especially if we see it that way. But if we see the link, as Radley has just said, between self-care as in knowing what not just restores us, but rejuvenates us, revigorates us, connects us to joy, to life, that's the quality of presence that we bring to the bedside. That's the quality. Our quality of life is the quality of presence that we bring to the bedside. So that's why our quality of life matters, and that's what self-care is about.
Beautifully said. Well, I'll mention we're coming toward the half-hour mark, which was our official stop time. But I'll summarize. There are very, very many references to walking, running, being in nature, near the ocean, being silent in nature, spending time meditating in the home or in nature. So a lot of folks who resonate with that and with your practices.
Denise, I was going to ask you, would there be any way, if it's not too much work, of kind of printing out those suggestions? So
I was thinking the same thing. Yeah, I think that would be great. And I will speak for my wonderful team and say that we do have the technology to do that. And as we send out the link to the recording, which you all will get tomorrow, we'll include, and actually I've been putting in the chat box, as you all have mentioned, articles. I've found most of the links, I think. So check the chat box for the links to the articles that have been referenced thus far. Tomorrow, when you receive the link to the recording, hopefully we will have figured out a way to also include all of these wonderful, wonderful ideas that you all are sharing with each other. And many of them have to do with things people are doing individually, but some of them have to do with what teams are doing together to create that safe space for self-care together, which is also very, very important. So we will, yeah, go ahead.
You know, there is this offer of, we teach together every Sunday morning at 10, and I teach Monday and Wednesday nights, and those are all free.
We could send that link.
And we can send that link to you. So whenever people like to Zoom in, there's no obligation, but it's just an incredible offering, I think, for people to just take advantage of.
Thank you. Thank you. That would be beautiful. And actually, I will ask you, because you referenced the grief sessions you're doing with Inside LA, if you want to forward that link to us too, because I know a lot of people would be interested in attending those. Well, you know, we are at time. I just, again, want to thank you from my own heart, but from our membership and our audience today. Thank you so much for giving us yourselves today. Those of you who have more questions and have more comments, Rodalie and Michael have generously shared their contact information. Feel free to reach out to them, and they will connect with you as they've done with us today. And I just want to thank everyone again who tuned in today, who's listening to the recording. There is an evaluation of this webinar that will come up on the screen immediately as the session ends. Please fill it out. We value your feedback and we do use it to plan future webinars. Please save the date for our next webinar. It is another in our series of best practices, navigating new realities in the times of the COVID pandemic. And it will be on challenges and lessons learned at a Catholic hospital. It will be on August 4th from 1 to 2 p.m. Eastern Time, presented by Dr. Natalie Rodden, a physician working in Centura system in Colorado. The registration for that webinar is now open on our website. And so again, thank you both. Everyone listening will receive a link to the recording to this webinar with the resources we've mentioned today. And again, be well, everyone. May you live with ease and be exquisitely kind and compassionate to yourselves in these difficult times. Thank you again.
Thank you.
Thank you.